Hi, I'm Matt Britt with Wake Forest Baptist Health, and I'm happy to be here at High Point Medical Center, joined today by two of our expert bariatric surgeons that practice right here at High Point and are here to tell us a little bit about bariatric surgery. If you or your family have considered bariatric surgery or are looking for options to handle your weight loss challenges, these two guys are great people to talk to, so we're excited to be joined by them. Let's talk through a little details here. Dr. Nik Teppara, Dr. Andrew White, thanks for joining us today.
Thanks for having us, man.
Yeah, appreciate it. So real quick for our audience, we'll start with you, Dr. White. Just tell us a little bit about your experience, your training. I think you actually trained with us here at Wake a little bit, and what got you into this field.
Yeah, so first of all, I've been born and raised in North Carolina, lived here my whole life. Charlotte, then NC State, then Carolina, then I did all my training at Wake. So I did my residency and my fellowship there.
Okay, awesome.
My fellowship was done actually in bariatric and minimally invasive surgery over there. And then fortunately I was fortunate enough to stay on the family, and they brought me down here to High Point to join Dr. Tapar to kind of help with this program as well and kind of learn the ways that he does. So that's the majority of what I am. I'm excited to be here.
That's great.
Excited to join the team.
That's awesome. Thank you so much. Dr. Tapar, you want to tell us a little bit about yourself as well?
So yeah, I've been kind of running around, my whole life. I did my undergrad at St. John's University. I was on a tennis scholarship out there. So I did medical school at University of South Carolina, where my parents are currently. That's where they call home.
Okay.
I moved here about 10 years ago after finishing my residency at Stanford Hospital as part of Columbia University's program in Connecticut. After I finished my training, I started up the robotic program here, which we now have an epicenter.
We're going to talk a little bit about that.
And then started a bariatric center from scratch, and we made it into a center of excellence and a center of blue distinction. And with Drew, we're going to take it places we never would have thought possible. And High Point's going to be a mecca epicenter of bariatrics.
That's awesome. Your energy is contagious. I hope you found that as well, Dr. White. So,
thank you, man.
So I love it. I love it. So let's get into it a little bit. Let's have a little bit of a conversation here. So we want to start out, Dr. Tapar. Obviously, moving into that step of surgery or surgical option for bariatric surgery is a big step. Tell us a little bit about where patients are from a mindset and a current state standpoint when they make the choice to seek out bariatric surgery or kind of think about that as their best option to go forward.
Well, no question, obesity is a disease, and the reality is that many of these folks have been dealing with weight issues their whole life. And so it gets to a point where now they're starting to develop multiple comorbidities such as diabetes and high blood pressure, cholesterol issues, and there comes a point where their weight is such an issue and them developing these multiple medical problems that's where their primary care typically tends to step in and say, you really should look into bariatric surgery. This can help not only alleviate the obesity, which is the cause of these medical problems, but then resolve or completely cure all these different medical problems. So that's when folks really kind of start to pay attention to this. And typically we look from a technical standpoint, having a BMI of 35 to 40 with a comorbidity, which again we call like blood pressure, cholesterol, those types of things, or 40 and above with or without any comorbidity.
Gotcha.
And unfortunately in this age and pandemic, we've had a lot of folks, this has always been an issue with obesity, and this has really now come with the pandemic, really highlighted how a severe disease process it has for, basically America.
Yeah, and to your point, obesity is really its own pandemic.
Right.
In this day and age that we're dealing with, it's its own pandemic, and certainly a scary thing for us. So that's really good information. So Dr. White, I know from experience and being around some of our weight management experts across our system, that we have a lot of different surgical options. Some that people may be familiar with, like gastric bypass is kind of a go-to name. There's lots of options. Does a patient need to kind of have an understanding of what they're looking for coming in, or do they just come to you for consult and you kind of help them through that process to understand the best option for them?
Yeah, Matt, that's a good question. I think that a lot of patients, they're scared about what bariatric surgery is because they've had friends who've had bariatric surgery. Maybe they know someone who's had some issues with it. Maybe some people know people who've had great response to it. So I think just the generalized knowledge of bariatric surgery and the perception of it is really not what it is. And I think the best way that we can benefit our patients is we offer a seminar. It's once a week. You can come and you can just learn about the different weight loss options, what it is, kind of put some of those perceptions that you may have in your head to rest, whether they be good or bad or whatever it is, and then you can hear it straight from the horse's mouth. And you can hear us talking about what a gastric bypass is, what a sleeve gastrectomy is, what a duodenal switch is. And the important thing that I would say is we don't even at that point in time talk about what the best surgery for that patient is. We just go over the options. Whenever after the seminar, we have you come back and see Dr. Tapar and myself, and then we talk about what's best for you.
Yep.
And I think that's what's important, is finding a weight loss surgery that fits you. And not only if, and some people we say, you know, maybe weight loss surgery isn't for you, but we also have the medical weight loss side of things that's also associated with our bariatric program.
Absolutely.
And some people really benefit from that. And I think that's what makes us important special is a weight loss program, is we have both of those arms and just our ability to talk through all those things.
You make a great point about just not just surgical options, but non-surgical options, because the you know it's we're here to help you and evaluate your process as an individual, and no two treatment plans are going to be alike, right?
That's right. And getting in the door, getting into weight loss specialists where you have exercise physiologists, dietitians, psychologists, psychiatrists, as well as surgeons and bariatricians, all geared to bariatric medicine. Let us to help you decide whether we think surgery or non-surgery is, you know, correct. I think people get nervous about it and immediately don't pursue that path, when I think if they, you know, were able to get into the program and discuss it with all these different specialists, I think they'd make the right decision.
I agree. So that's a great segue. So from you talk a little bit about the multidisciplinary team, as we use that term a lot.
Yep.
So talk to our patients about what they should expect if they do end up needing a bariatric surgery. What kind of post-surgery support? Because we know that that's a hard process, right? We know that the surgery in and of itself is not singularly the answer.
Right.
So talk about the kind of support system that we provide them pre and post-surgery.
Right, and you make a great point, Matt. You know, Drew and I, what we do is we provide a tool. We
Right.
provide a tool for a patient to use, and that helps with weight loss. But it's a multidisciplinary approach. So there's, again, psychiatrists, psychologists, nutritionists, dietitians, exercise physiologists, all together working with you post-operatively at multiple different levels. So we're touching the patient every few weeks, making sure we're helping them through that transition. And years out, you know, the follow-up is for life, really. So
Yeah,
the patients need to know that they're taken care of for life, and that we'll always be with them through every step of the way, whether they have weight regain or different issues, stress in jobs, which is causing, you know, all these types of stuff. Is a multitude of different reasons why we regain weight post-op. So we're there for, you know, for support every step of the way in every facet imaginable.
That's great. It's such a passion-driven effort that you and the team are going through. So it's really cool to hear about.
Yeah,
and hopefully I hope our patients or potential patients that are watching feel that.
Yes,
because
absolutely.
it's a really cool piece of what we do in a lot of different specialties, not
That's
just
right.
weight management.
Yeah,
So,
absolutely.
speaking of other specialties, Dr. White, obviously I know that you and Dr. Tapar don't just do bariatric surgery. That's an important piece of what we do here at High Point and what you two specifically are engaged in. But you have other treatments and conditions that you provide to patients here locally, correct?
Yeah, that's absolutely right. I mean, Dr. Parr and myself both love general surgery.
Okay.
We both actually specifically have a real affinity for doing foregut cases, hernia cases, and any sort of advanced laparoscopic robotic surgery, since we both do robotic surgery as well. So I think that that's kind of one of the things that makes us special. Is we don't just do bariatric surgery too. We can also help patients with other medical problems and kind of get a little bit of a bigger picture about the global view of a patient.
Absolutely.
And
I
I
just want to
think
make
that
sure
makes
patients
us-
understood that.
Yeah, and it makes us more of a complete surgeon, I think,
Yeah.
the fact that we can handle all these different, you know, facets of your health.
Absolutely.
When it comes to surgery.
So again, we're working really well on a segue front right
Yeah.
now. So he mentioned robotics. We talked about some other surgeries.
Yep.
So I want to talk a little bit about this recent honor that we have, or I think specifically that you have, Dr. Tapar,
Yep.
as being the first in the state epicenter of Da Vinci robotic technology.
Yeah, for general and bariatric surgery. That's
Yes.
correct.
So yeah, that carries over to both.
Yep.
So talk to our patients. Obviously, we like to talk about the fact that Wake Forest Baptist Health, as an academic medical center, is cutting edge. High Point is part of that as well. So this is an important cutting edge technology that we have, and maybe hard for patients to understand, but what does it mean to them? Well, we know it means a lot to us, but what does it mean to them and their outcomes?
The Da Vinci robot is just a robotic platform where it's now the next step of minimally invasive laparoscopic surgery. So we can actually operate using the robotic arms and make very fine movements, which leads to less tissue trauma, less bleeding, which can lead to faster recovery, quicker returns to work, decreased length of stay, all these benefits to the patient.
Absolutely.
So in terms of general surgery and robotics, you know, I started robotics in 2013, and you know, we've done a fair number. We're now approaching 1,000 cases, and so the robotic company named, you know, me and the center here at Epicenter. And what that means is that surgeons and their teams can come visit us if they want to start doing robotics and do case observations, and their teams can ask questions and watch us operate, and the surgeons can watch me operate. And once they want to establish a program in their hospital, then we can come help them do that. So
That's great.
it's very neat that all that is in High Point.
Yeah, happening right here at High Point.
And so we've had folks from all across North Carolina, South Carolina, Virginia come visit.
Yeah, some of the biggest health systems. That's really that's really cool that you're doing that. But again, to your point about the patients, it's really a much more efficient process.
Yes.
At the end of the day, it's a much more efficient process to get you back to good and back to your best you, so to speak.
That's right.
So that's awesome. Yeah, we're really excited about that.
Yeah.
So we're talking about a lot of services, a lot of things that we offer to the patients here locally. Dr. White, do these patients need a referral, or can they self-refer? How does that process work?
Anyone can come to a seminar. All you have to do is you can give us a call and say, hey, I want to come get a little bit of information, come to the seminar. The seminar, it's not binding. You can come to the seminar, get some information, it's free, and if you never want to go through bariatric surgery, you don't have to. If you're more interested in the medical weight loss side of things, you can do that.
Absolutely.
And in fact, you can even go there, and then you can even come to see Dr. Tapar or myself, and then you ultimately will need a referral placed, but you can come get a little bit of information about it for yourself if you're interested in it, or if someone's a little bit hesitant to actually make that referral first.
Absolutely. And we talked a little bit about that earlier. So we wanted to make sure that patients know, and we'll give you a website to go to find that link to sign up for the seminar, and a phone number as well. So we'll give you that at the end, so stay with us. Dr. Tapar, you mentioned in the opening a little bit about the Blue Cross Blue Shield Blue Center of Distinction.
Yep.
Again, similar to the robotics thing, it's a big thing internally. It means a lot to us internally to have this honor. One of the only ones in the region, or one of the first in the region. And so what does that mean to the patient? Again, what does it mean to them? Why should they care that we have this Blue Cross Blue Shield Center of Distinction?
Yeah, that's a great question, Matt. So the reality is this is a great distinction, because what it really shows is that if you meet certain requirements, you show excellence in your program, low complication rates, and etc. We have the accreditation, which first we were a center of excellence, and then Blue Cross Blue Shield has given us this distinction. So they want their patients to go to centers of blue distinction because they've been proven to be the centers of highest care.
Gotcha. Okay.
So what that means is now when they're coming to these Blue Cross Blue Shield centers of distinction, which Wake Forest is actually one as well.
Correct.
This really shows their confidence in our program.
Right.
In fact, this is where they want their patients to have their operations, and that really, with Wake Forest's help, we were able to get that accreditation.
Absolutely.
And we're very proud of it, and it also goes to show our excellence and our, like I said, our low complication rates, our fantastic results, and so that's what that alludes to.
In a simplistic way, it's a validation, right? It's like the 5-star review that you're getting online for a product you're getting ready to buy.
That's right.
Same kind of thing for the services that we're offering here.
That's right.
So that's awesome and really exciting. So that was as of January 1. So,
Yep. Correct.
That's very cool.
Yep.
Very cool.
We're excited about it.
So Dr. White, one last question to kind of wrap things up. We know that we're in the middle of this pandemic. We talked about the obesity pandemic, but we also have the COVID pandemic. Unfortunately, we're wearing masks. We're inside. This is kind of part of our process of safety. We know there's patients out there that are hesitating or delaying care, or hesitating to come to see a physician about some need that they have. Can you tell our patients a little bit about the safety protocols we have in place and how we're maintaining and guaranteeing their safety?
Yeah, I think what's important to know is that first and foremost, our concern is the patient safety. So whenever we do have seminars, we actually offer the availability to do a seminar online, or you can come in person. If you come in person, we're properly socially distanced. Everyone wears masks. Yes. We're limiting the number of people that we have in those seminars to just 10 people so that it's safe.
Okay.
And as far as just surgery and stuff like that goes, well, we actually went through a process during the height of the pandemic. We were limiting the amounts of surgeries we were doing because a lot of our patients are high risk because of their medical comorbidities and their obesity.
That's correct.
But that being said, as the pandemic lightens up, we're starting to get back into the swing of doing more of the bariatric surgeries. And I think more patients will feel more comfortable coming and learning a little bit more about bariatric surgery and things like that. As far as other things right around the time of the operation, everyone socially distances as best that they can in the hospital. Everyone wears masks. Correct. You have to get a COVID test before surgery. You have to actually isolate for 7 days before surgery because we want to be sure that your risk of having COVID before surgery is really at a minimum, and that's for your safety.
Absolutely. Absolutely.
And what I would add to what Drew was saying is it's actually the opposite. Folks are scared to pursue bariatric surgery, but the reality is COVID has been shown that the folks that have obesity, they're one of the highest risk categories. Yeah. And so this is actually the time to get the weight off to make sure folks are back into a normal BMI because they're actually at a higher at risk right now having that excess weight.
Yeah, that's a great point. That's a great point. And to your point, Dr. White, we just have there's so many protocols in place. We know about them, but we like to continue to reiterate that to our patients. So I appreciate that clarification. And hopefully, as we continue with the vaccine distribution, hopefully at least we can see the light at the end of the tunnel right now. So, well, gentlemen, Dr. White, Dr. Tapar, thank you so much for joining us today. We really appreciate you being with us.
Thank you so much.
This is
Thanks
great.
for having us.
And we hope you enjoyed the conversation.
Yep.
If you'd like to learn more about our team or make an appointment, you can go to www.wakehealth.edu/highpoint. That's wakehealth.edu/highpoint. Or you can call 336-716-WAKE. That's 336-716-9253. Thank you so much for being with us here at High Point Medical Center. We hope you have a great day.
Thank you.
Thank you.